Medical cost sharing may seem complicated, but it's not. It is simple to use, and you can do it all online thanks to a sophisticated computer algorithm.
It really helps to keep costs down. It helps to make a lot of things self-service, lets everyone contribute or participate without having to involve a lot of unnecessary steps. There's a lot of people who who aren't used to technology, who don't take advantage of it. There are people who just by lifestyle choice choose not to engage in technology, and so that's where the customer support, the customer service center comes in.
And that service center is loaded with workers who are also members using medical cost sharing.
For the person who looks to have a question answered, we want them to feel like they can call us, and that's what we're here for. We're here to answer your questions. It's not an imposition for you to call and ask a question, even if the answer really is in the guidelines.
They can answer specific questions like pre-existing conditions, which are accepted in medical cost sharing.
We do accept pre-existing conditions. And we have an elimination schedule that we go through in terms of the first, second, third year, and fourth year and after. It's no longer considered pre-existing.
If they've had and gone through treatment, if they've completed their treatment and have gone 2 years without symptoms, medication, or treatment, then it's no longer pre-existing to us.
And if you have these 6 conditions, medical cost sharing will also take you, and you will go into a provisional program.
And so if you have those kinds of conditions, we ask you to join with us. We accept you fully as a member, but we assign you a health coach with specifically kind of actual customized care plan that as long as you meet those health care targets or lifestyle change targets and improve your health, we want you a part of our community.
What's great about our health and wellness director, she will deal with their doctors and make sure that they are following a path that is healthy and that is within the realms of what their doctor would suggest.
And it works.
Since then, I have lost 20 pounds, my blood pressure is down to normal, and I am totally off my medication. And I feel great. I feel like a new person.
Another concern for members might be their healthcare providers. Will they accept payment?
And in fact, providers' biggest expense is all the back office administration that it takes for them to argue with the insurance companies to get their payment. We've eliminated that completely because now it's a decision between the patient and the doctor, and our reimbursements are fair, reasonable, and timely, and they love it.
Plus, the reimbursement schedule is on the back of your membership card. And
if your provider doesn't accept it, then we're going to work with them. That's our commitment. Pick up the phone, have them call us, call while you're in the office, or call us before you go to your provider. Let us send out their letters. Let us get them on the phone. Let us try to educate them on what medical cost sharing is and who Liberty Health Share is.
The quickest way to see if you are eligible to be a member of medical cost sharing is to go to the website.
We always encourage them to enroll online because that's the simplest way and the fastest way for us to get it, and to go all the way through to where we have your medical history.
And don't worry, your medical history is safe. You will not be charged until you choose to be. Liberty Health Share takes an administrative cost of only 12%.
Our mentality is we're here to assist and help each other. We're, as the members, it's a member-owned, member-driven, member-decided program. And so who best to help calculate and determine what meets the needs of the community the best than the members?
And that can save members hundreds of dollars a month and possibly thousands in upfront medical bills yearly.
Medical cost sharing is just simply where a group of like-minded individuals join together for the express purpose of sharing their monthly medical expenses. That's cost sharing. It's individuals who are simply banding together outside of the traditional insurance world and simply sharing their medical expenses on a mutual basis.
And that keeps costs down in 4 ways.
One is we access medical care at deep, deep discounts because we have a reimbursement schedule that doctors and hospitals accept. Number two, we attract health-conscious people. Health-conscious people are typically have fewer bills, recover more quickly, and those of our members are very conscious about their health and their healthcare costs. We unleash probably the number one consumer most powerful consumer product in the marketplace in terms of maintaining costs, and that's the self-pay patient. We are all self-pay patients responsible for our own bills, and our money's at stake. So who is better to look at and manage and control our own money than ourselves? We've got skin in the game. And so we review those costs and make sure that the procedures are correct and we are looking out over those expenses. The fourth one, which is really important as well, is that at Liberty Health Share, all of those costs that come in and are reviewed carefully to make sure that the billing is correct. Because there's a massive problem, frankly, in the healthcare world in terms of billing mistakes. And so those are reviewed for accuracy and that the services that are provided are actually the services that are received.
It is allowable under the Federal Affordable Care Act, known as Obamacare. Each year, you will get a notice to submit with your income tax filing.
And that's all the requirement that is needed under the law for our members now to be exempt from the penalties under the Affordable Care Act if you don't have insurance.
Still, medical cost sharing is not health insurance and has nothing to do with the health insurance industry.
So their motivation is profit-based to try to collect the most amount of money and pay the least amount out.
So medical cost sharing is simple and exciting.
And we're changing people's lives. It's just thrilling every day. For the number of testimonials that we receive from individuals who have had drastic changes in their life because of their involvement with Liberty Health Share, taking responsibility for their health and being health conscious.
Liberty Health Share. There is an answer.